What's up, guys? Ryan McWilliams here. I'm with Dr. Kyle Richmond at Rebuilt Performance. We are going to be talking about a topic on elbow pain and some things that Kyle has seen with specifically baseball pitchers coming in to seeing him with elbow pain. So I'm gonna leave it up to Kyle, explain to you guys some of the things that he sees.
Yeah. So guys, the thing I see the most is a lot of people complain about inner elbow pain. So what I look at is one of the basic movements for our elbow should be rotation. A lot of guys don't train it, or a lot of guys think that they're doing the right things, they're missing it. So when we go ahead and we throw our arm back to pitch, our elbow has rotation, okay? So what I look at is your ability to pronate and supinate without flaring the elbow. How much true rotation do you have, not borrowing from the wrist and not borrowing from the shoulder?
And that's the other thing too, is that a lot of athletes, the way that they're positioned and the way that their posture is positioned is going to dictate a lot of the function. So a lot of the rotational torque that he's talking about is really going to start coming from the static position of the shoulder. So think about in our normal daily life, we're on our phones, we're on the computer, we're sitting in school writing, we're going to be more preset into an internal rotated position of that glenohumeral head of the shoulder.
That's correct.
And so when you're coming set as a pitcher, right, and we're more internally dominant here, in order to flip my arm up into horizontal abduction, I have to rotationally move that elbow, which is putting torque. And then when we hit front foot strike, now we're going into a passive range of motion at layback. So what are some of the things that athletes can start doing to offset that stress or even fix the static position of the shoulder to take off stress on the elbow?
Absolutely. So if we're looking at the shoulder, my big thing is external rotation. You have two things. You have your passive and your active. So passively, I can take Ryan back as far as his joint will allow me to, okay? Then we look at active. How much can he do that motion? For most guys, I'm looking at about a 1-to-1, even getting close to a 90% ratio. Where I see a lot of people go wrong is, let's say they can only get to here, okay? Now, when you go to lay back for a pitch, you need to be able to get crazy amounts. So there's a certain amount of range of motion you might not have control of, and that's where we see guys blow out tissues. They'll blow out parts of their elbow because it's not used to the stress here. They blow out parts of the anterior part of the shoulder. A lot of biceps tendon issues or anterior shoulder issues come from an inability to actively externally rotate their shoulder. So we'll go over a couple things you can do to get active external rotation of your shoulder and also improve the rotational capacity of your elbow. Looking at Ryan's elbow, first thing I do was out weight. I want to see how well he can actively pronate and supinate through the elbow, not by using the wrist. A lot of guys will crank through just the wrist and try to do everything here, not create the movement from here. So I want you to squeeze your fist. He's going to rotate as far as he can, squeezing through the elbow, and then we're going to open up as far as we can from here. Good, back and forth. And you can see there's a lot of shaking and force being put in here. It's not something quick and easy we can do. I want you to really take a lot of tension and intensity. He's opening up, 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 driving force through the elbow, and then pronating. So now, if he has those prereqs and he's not doing this, he's not flaring his elbow, he's not cranking through the wrist, I'm okay loading it. I like a mace because it's offset load. A lot of people with dumbbell, it's too easy. So what I'm gonna have Ryan do is go back to that same position. Again, we're trying to get force through the elbow. He's gonna open up, open up, open up. A lot of guys will feel a good stretch in the inner part of the elbow, and he's gonna actively come back. Now this is only 5 pounds. It's offset. It doesn't take a lot to start, but I want full on range of motion, really stressing that elbow joint. Good, far, 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 until we feel the wrist compensate. Then we come back through and you're gonna feel a lot. You might feel bicep. Bicep also helps with supination. Good, and one more, all the way back, 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 back. You can do this with a band, you can do it with a mace. A dumbbell's not a bad place to start if you don't have a mace, but you'll have to offset it. Okay, so next thing we're gonna focus on is active external rotation. What I'm gonna use is the rig and have Ryan start with his arm a little more in front of him. We're gonna see how well he can take his wrist and rotate into external rotation. Good, and come back. Where a lot of guys will go wrong is they'll crank through extension of the wrist and they'll just try to borrow motion from here. Ryan's doing a good job of either keeping the hand flat or you can make the fist like we did before and drive all that motion through the backside of the shoulder. If he's good more in front here, I'm gonna open up his torso more. Again, trying to keep the elbow on the rig, actively go through here. We're trying to fire the backside of that shoulder. And back, good, a couple more. Good. So if someone struggles with this, I highly suggest starting them a little more facing. Once they get better and better and better, we can open up Ryan as far as we possibly can through the torso, and now the movement's gonna be very small, but he's firing back here. Ryan also does a very good job of having active control. Most of you might cramp out in the backside of the shoulder and not have the ability to do this.
And what also help with that is the scapula will posteriorly tilt, which will take less stress off that local external rotation of the glenohumeral head.
Correct, yeah. So, and you can even as a coach or clinician come back and help tilt.
Yes.
Good, and come back. So you'll see a lot of guys, let's go ahead and dump your shoulder forward. Yeah, now go ahead and externally rotate.
Can't.
You can't, right? So we have to set the scap in a good position, which is something else we could talk about. Awesome. And relax.
Nice.